Hello, I'm Dr. Rekha. I'm practicing as an obstetrician and gynecologist at Nurture Hospital, Rajajinagar. One of the common questions which people ask me in my OPD is, do I have PCOD or PCOS? There is a little difference between the both. PCOD is a structural ovarian disease which can cause significant problems with ovulation, menstrual abnormalities, and difficulty to have regular periods, maybe missing periods. The hormonal imbalances generally causing trouble with menstruation. Whereas polycystic ovarian syndrome is a larger part of the same disease which will involve other organ systems, endocrine systems. It is significant metabolic impairment for the patients, which insulin resistance, probably diabetes mellitus, lipid and cholesterol abnormalities, and definitely a lot of difficulty in getting pregnant. So the common symptoms of PCOD will be irregular menstruation, anovulation, excessive hair growth on the face, especially around the chin, pigmentation in the armpits, genital area and the neck. We call it as acanthosis nigricans. The excessive hair growth is called as hirsutism, and because of chronic anovulation, women don't tend to have regular cycles. When all these symptoms come together or a couple of them, it's important that you visit a doctor and not ignore. It's important that girls have at least 10 periods in a year, if not 12. Many patients, mothers mostly, ask us that my daughter is bleeding heavily. She has one period every 2 months. And then some people say, my daughter has one period twice a month. She has a period on 1st of May and she has a period on maybe 25th of May. That does not mean that she is having too many. Menstrual periods are called cyclical bleeding of the uterus whenever the uterus is ready to shed. It is not called a menstrual date. It does not mean that it has to come on the same day every month. It is called cycle for a reason. Anybody who has a period between 22 and 30 days or maybe 32 days is considered to be having a regular menstrual cycle. There are 3 very important things for us to test before we diagnose polycystic ovary. One is the patient walks into the OPD with complaints of not having cycles, missing periods, having too much hair on the face, bad oily acne skin, or inability to conceive, too much of weight gain. These are the symptoms. Second thing is an ultrasound to look for polycystic ovaries. That means both the ovaries are laden with cysts. These are all eggs which did not ovulate. They just sit in the ovary and become cysts, and they make the ovaries heavy and hence destroy the hormonal environment of the ovary. The third one is the hormones. Hormones which affect the ovulation and menstruation, which is done typically on day 2 or day 3 of menstrual cycles. Any of these hormones could be abnormal. These are the 3 important things. First one is symptomatology, second one is ultrasound findings, third one is hormones.